Escherichia coli 015787. This is a strain of E. coli which we have heard about a lot. It's very important with respect to food microbiology because it's an important food and waterborne pathogen that causes diarrhea, hemorrhagic colitis, and hemolytic uremic syndrome, or HUS, which I'll call it that from now on in the video. This infection sometimes progresses into a life-threatening form of the illness, which causes kidney failure and other problems. Most at risk are children and people with weakened immune systems, but so is the general population when it comes to this particular organism. Back in 2020, FDA reported an outbreak of E. coli associated with lettuce from the Salinas Valley, contaminated lettuce. Out of 167 people who were infected, 85 ended up being hospitalized, including 15 people who developed HUS, a type of kidney failure. It's because of these reasons and the severity of the infection that can come from this E. coli strain that there's a lot of interest always in the presence and detection of E. coli 015787. Hello, everybody. Once again, I'm your host, Dr. Yu. This is our channel, Microbiology Explained. This is part of our food safety series. In today's video, we're going to talk all about Escherichia coli or E. coli. In this series, we're going to dive into the ins and outs of food microbiology. We're going to talk about the good actors. We're going to talk about the bad actors with respect to food. In the past episode, we talked about Listeria monocytogenes. Today, we're going to be talking about E. coli, everybody's favorite microbe. Generally, I should start with E. coli 015787. The 015787 is a designation or strain designation because we know that there are over 1,000 different strains of E. coli. Some of them are pathogenic, others are not. Hopefully, I'll make a video discussing several of those strains of great interest. As a whole, the strain and E. coli can be found in soil, animal reservoirs such as cows and ruminants, in food, especially undercooked beef and beef products, some raw milk, yogurt, mayonnaise. There are very many sources. Lettuce, sprouts, sometimes associated with that. The key to this particular strain, 015787, is that it produces a sugar toxin. So at some point in time in the past, genetically, this organism has acquired the ability to get a sugar toxin. Sugar toxin is a toxin from another species of bacteria or another genus called Shigella. And so it has a mixed characteristics, both of its own genetic systems and new traits which it has picked up along the way. E. coli is a gram-negative, rod-shaped facultative bacterium, like I said, capable of producing the sugar toxin, this particular strain. The microorganism was first discovered by Theodor Escherich back in 1885, please forgive my German pronunciation, during an outbreak investigation into hemorrhagic colitis. There's a wonderful picture of Escher for you to admire. So, typically it comes in through the fecal oral route of entry, and after being ingested, 015787, usually in contaminated foods, the bacteria binds into your mucous membranes of your intestine and begins to release the sugar toxin. And that is part of the reason why it's so deadly, because it's not just the infection of the organism itself and the multiplication of that organism which causes damage, but that it produces a toxin which has such a strong, potent ability to hurt. Usually after 3 to 4 days of exposure to contaminated food, you start having a problem, and 80-90% of patients start having an infection that is seen. Typically, beef products are often associated with this, and they become contaminated during slaughter if the right slaughter processes are not taking place, and if the meat is not fully cooked afterwards. Therefore, the bacteria can still survive in the meat and thrive and grow. The pathogenesis, a little bit deeper into that, or how does it cause disease? As a whole, all people are believed to be susceptible to hemorrhagic colitis. More especially children and elderly and people with compromised immune systems, they are even more susceptible. The mortality rate in patients when the illness adjusts or progresses to the HUS stage, the hemolytic uremic syndrome stage, the mortality rate is about 3 to 5%, which is quite serious. Also of great importance is the infectious dosage. The infectious dosage is usually defined as the number of microbes that you have to be exposed to before you exhibit the symptoms, or before you become you exhibit the symptoms of the disease. And for this particular strain, is between 10 and 100 cells, or as few as 10 and 100 cells, which is very, very few in the world of bacteria. That means with just a handful of cells, there can be enough cells to start you having this infection. And the symptoms include severe abdominal cramping, nausea and vomiting, diarrhea that is very, very watery sometimes and bloody, sometimes bloody urine and loss of appetite, and often a low-grade fever can be present or absent, depending. Also, the diarrhea can be frequent as 15 to 30 minutes, which can be very, very inconveniencing. The way to detect this E. coli 015H7, the old school methods are because this strain does not ferment sorbitol, so anytime you're plating on a media that contains sorbitol, you can isolate or differentiate this from other E. coli. Nowadays, we have much more sophisticated molecular assays which can go for markers which are unique to this strain and enable us to identify the strain in a culture very, very rapidly. Back in 2020, the CDC and FDA investigated a multi-state outbreak in which 15 people were infected from 10 states. This outbreak was later determined to be associated with the consumption of baby spinach. Of the 15 people, 4 people were hospitalized and 3 ended up developing HUS. Fortunately, no deaths were reported. There was another outbreak in June 2022 in which there were 6 cases of E. coli and 6 patients which were found to have been infected by E. coli. And this particular case was organic power greens were the suspected culprit for the carrier of this disease, of this organism. Generally, the sources for E. coli 01578 are raw undercooked ground beef products, raw milk, acidic foods, maybe like yogurt and mayonnaise, which haven't been thoroughly acidified or haven't been probably thoroughly treated, contaminated water, recreational sports, and leafy greens, vegetables like that. So there's a wide range of foods which we are concerned about, which can be carriers per se. However, there are ways to prevent it and ways to regulate it. And cooking your beef and your meat very well is perhaps the primary way of ensuring that there's no E. coli infection associated with that. As for vegetables and fruits, washing the vegetables with clean running water with a slight bit of sodium hypochlorite bleach added to it, which will kill or reduce the population of a lot of bacteria present. Not drinking unpasteurized raw milk and certain sort of cheeses, and in general, good hygiene practices, especially in the handling of the food prior to being served and eaten, will help prevent this disease or prevent the bacteria from infecting you and causing the disease. And unlike Listeria, which we mentioned in the last episode, E. coli can be controlled by low enough temperatures. We're talking about 40 degrees Fahrenheit or below. Treatment. There are methods of treating it, generally supportive maintenance care and plenty of rest with food and with lots of water to keep the patient hydrated. Antibiotics have been shown to have a limited amount of effect, but as always, the best cure is not to get sick and to handle the food properly from the initial stages. So, in summary, we have E. coli across the board. There are many, many strains, but one particular strain of interest is 015H7, a sugar toxin producing strain. Within the 0157, there's a subset of enterohemolytic E. coli, often referred to as EHEC. Hopefully, I'll have a chance to do a video about them. They're an interesting subset because they have their own traits and they have different pathogenic properties from even the rest of the 015H7. Currently, of 0157, the predominant strain, EHEC infections are the most which are seen worldwide, and generally this is a concern for most governing bodies like FDA and USDA. A lot of the times they mandate or require a certain amount of testing for foods in order to make sure it doesn't come and affect the populace. So, as always, I hope you get something out of this video. Once again, this is Dr. Michael. This is my channel. Like, subscribe, and I will see you all in the next video. Thank you very much. Have a good day.